Zach, thank you very much. A new report shows the rest of the nation is doing better than Michigan on a number of critical healthcare issues. It also calls for a refocus on ways to improve healthcare outcomes in our state. Capitol correspondent Tim Skubic is here for you now with more on what the report had to say.
One thing you could say about Michiganders, they love to drink, they love to smoke, and most citizens don't work out, and so 35% of them are overweight. So this report from the Citizens Research Council documents all of that stuff and says basically that Michigan's health care, well, it's a problem.
General kind of conclusion from all of this is that not only does Michigan have poor health outcomes, it also has poor health disparities.
Here are some of the findings. Michigan is less healthy than the national average. Life expectancy is lower than the national average. Health care has declined in Michigan over the last 20 years, and minorities are less healthy. And because workers earn less than the national average, that means the quality of health care that they receive is less than those who have more income. This disparity or difference in the level of access to health care based on money is holding back Michigan's economic progress, the report concludes.
Addressing health disparities as we're trying to tackle kind of the sickest populations, being able to make the people who are most in need healthier and then making them more able to contribute to a more prosperous state. And that feedback loop, then a prosperous state is what is needed to improve health outcomes across the board.
Under former Republican Governor Rick Snyder, Michigan made great progress in providing health care to those who need it most. But the research now suggests even that access may be at risk.
Now, on top of all the other things that we struggle with, we might potentially be dealing with that access issue, which is a necessary but insufficient condition for health outcomes, but we might lose that kind of necessary condition to begin with.
The CRC report hopes that policymakers will use this data to close the healthcare gap between the haves and the have-nots, which could be part of a long-term Michigan economic growth. Here for you in Lansing, Tim Skubic, 6 News.